Hello everyone, welcome back to Health Bulletin. As the temperature drops, we all know that colds, flus, and other respiratory illnesses become more common. But why is that? Well, during these colder months, we tend to stay indoors more often, which unfortunately allows viruses to pass more easily from one person to another. Plus, the cold, dry air outside may weaken our resistance, making us more susceptible to these illnesses. So, if you find yourself coughing and sneezing this winter, how can you tell if it's just a common cold or something more serious? Do you need antibiotics? Are you contagious? So what exactly is a common cold? It's an infection that affects your nose and throat, and sometimes even your ears. But how do you get it? Well, it's usually because someone coughed or sneezed near you, or you touched a contaminated surface like a doorknob. There are more than 200 viruses that can cause colds, but the most common culprit is the rhinovirus. In a word, yucky. You probably have a runny nose, scratchy throat, low-grade fever, fatigue, chills, and aches. And yes, you're probably sneezing and coughing a lot, while flu affects your respiratory tract and is more severe than a common cold. It's highly contagious and can lead to serious complications. Its symptoms include high fever, body aches, exhaustion, and sometimes vomiting or diarrhea. As far as treatment is concerned, adequate rest, fluids, and medicines for symptom relief are recommended, as prescribed by your doctor. Antivirals such as Tamiflu may be prescribed if your physician advises it. And for prevention, annual flu shots are recommended as viruses evolve each year, while RSV leads to inflammation in the respiratory tract. The symptoms of RSV might seem similar to a common cold, but there are some differences. Along with the usual cold symptoms, you might also experience wheezing and a decreased appetite. In children younger than 1 year, RSV is the most common respiratory cause for hospital admissions. Most children and adults with RSV will recover in 1 to 2 weeks. It is very common among infants. 97% get RSV by age 2, and 60,000 to 120,000. Older adults in the US are hospitalized with RSV every year. So how do we treat RSV? The treatment is mostly supportive care like rest, fluids, and over-the-counter children's acetaminophen. And the good news is, there are RSV vaccines available. As the flu season begins, we want to remind you of the importance of staying vigilant about your health. Respiratory symptoms, which can often seem mild or common, should not be overlooked. Seeking advice from healthcare professionals ensures that you receive the correct diagnosis and treatment. Early intervention can significantly reduce the risk of complications and also helps to prevent the spread of illness to others, especially the most vulnerable in our community. Do not hesitate to reach out to your primary care center if you have any concerns or symptoms. Your prompt action can make all the difference. Don't forget to like, share, and subscribe to our channel for more health-related content. Until next time, stay healthy and safe.